Hello everyone. Today let us learn about diabetes mellitus. So the term diabetes is derived from Latin, originally from Greek, meaning that to go through, referring to a large amount of urine produced by the kidneys. The term mellitus in Latin means sweet. That is, the urine is having glucose. Diabetes mellitus together refers to the urine having glucose. Diabetes mellitus causes high blood glucose levels and glucose eventually spills into the urine. So let us know the definition of mellitus. What does that mean? It means that a variable disorder of carbohydrate metabolism caused by a combination of hereditary and environmental factors and usually characterized by inadequate secretion or utilization of insulin. Insulin is the hormone secreted by pancreas, and there is excessive urine production and by excessive amounts of sugar in the blood and urine, and by thirst, hunger and loss of weight. So let us see the diabetes mellitus. What are the signs and symptoms? Frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling or numbness in the hands or feet, feeling very tired much of the time, very dry skin. These are the symptoms of diabetes mellitus. So let us see the types of diabetes mellitus. Type 1, type 2, gestational diabetes, latent autoimmune diabetes of adulthood, maturity onset diabetes of young, neonatal diabetes mellitus. Type 1 diabetes ranges from about 5% of the population. Type 2 diabetes ranges from 85 to 90% of the population. Gestational diabetes around 2 to 5% of the women. Latent autoimmune diabetes of adulthood around 10 to 25% of people. Maturity onset diabetes of young around 1 to 2% of the people. Neonatal diabetes mellitus 1 in 400,000 infants in the US. So let us see the difference between the healthy individual and the person suffering from type 1 diabetes. In healthy individual, what happens is that the pancreas secretes the insulin and there is a normal glucose metabolism taking place. You can see in the upper diagram where the pancreas secretes the insulin. That is the green dots which you can see. That is the insulin, and the blue color dots is the glucose. Here you can see in healthy individuals there is normal secretion of insulin and hence there is normal level of glucose in the blood. Whereas in type 1 diabetes, what happens is that there is less insulin. And what happens? There is increased level of glucose in the blood due to the less insulin. Less glucose being stored or used in the organs. So let us see the types. There are mainly 3 types of diabetes: type 1, type 2 and gestational diabetes, that is diabetes while pregnant. Type 1 diabetes is thought to be caused by an autoimmune reaction where the body attacks itself by mistake. That stops your body from making insulin. Type 2 diabetes is most common one among population. That is caused due to the excessive glucose in the bloodstream. Type 3 is the gestational diabetes seen in the pregnant woman. So let us analyze the types of diabetes: type 1, type 2 and gestational diabetes. Type 1 diabetes caused due to the autoimmune disease. The actual cause is unknown, cannot be prevented, usually occurs in children, will require that a person take insulin every day to control blood glucose. Type 2 diabetes, the most common form of diabetes, many risk factors that may increase your chances of developing type 2 diabetes. The good news is there are things you can do to prevent it. Gestational diabetes. Gestational diabetes occurs in pregnant women. Gestational diabetes can be harmful to both the baby and the mother. So let us see how does insulin work. Here you can see the insulin and the glucose and the insulin receptor. Blue colored one is the insulin receptor and you can see the insulin and the glucose. What happens is that the insulin is the key that unlocks the glucose channel. That is, when the glucose level in the blood becomes very high, this insulin binds to the insulin receptor so that the excessive glucose metabolism will be maintained. That is the role of insulin. So let us see what happens. Here you can see the pancreas where the healthy individual, type 1, type 2. Let us see the difference between all the three. In healthy individual, what happens is that the pancreas secretes insulin and the insulin binds to the insulin receptor and there is normal glucose metabolism taking place. Whereas in type 1 diabetes, pancreas failure to produce insulin and hence the glucose metabolism is altered. Type 2 diabetes, insulin is secreted but unable to bind to the receptor. The receptor cells fail to respond to the insulin properly. These are the difference between the healthy type 1 and type 2 diabetes mellitus. So let us see what happens in type 2 diabetes mellitus where the pancreas secretes the insulin. What happens is that the pancreas produces insulin but it is resistant to effective use. Here you can see. So let us see what is pre-diabetes. Pre-diabetes is when your blood sugar level is higher than it should be but not as high as enough for your doctor to diagnose as diabetes. They might call it impaired fasting glucose or impaired glucose tolerance. People with type 2 diabetes almost always had pre-diabetes first, but it does not usually cause symptoms. So let us see the blood glucose chart. Normal, that is fasting blood glucose, it will be around 80 to 100. After eating, it is called as postprandial blood glucose. After eating food, it is called as postprandial blood glucose. After eating, it should be 170 to 200. After 2 to 3 hours after eating, the normal person should have 120 to 140. But in impaired glucose, the fasting level will be 101 to 121. After eating, it will be 120 to 230. After 2 to 3 hours, it will be 140 to 160. Whereas in diabetic patient, the fasting blood glucose itself will be 126 plus. After eating, it will be 220 to 300. 2 to 3 hours after eating, that is called as digestive and absorptive phase of the metabolism. That will be around 200 plus. Let us see what is GTT, that is glucose tolerance test. The glucose tolerance test, also known as the oral glucose tolerance test, measures your body's response to glucose, that is sugar. The glucose tolerance test can be used to screen for type 2 diabetes. More commonly, a modified version of glucose tolerance test is used to diagnose gestational diabetes, a type of diabetes that develops during pregnancy. So let us see the fasting blood glucose 2 hours, that is postprandial blood glucose and the random blood glucose levels. Coming to the fasting blood glucose level, the normal person, the value ranges from 70 to 100. Risk of diabetes, the Value ranges from 100 to 125. Diabetes patient, the fasting blood glucose itself will be around 126. 2 hours postprandial blood glucose. How it will be, that is postprandial means after having food. For those younger than 50 years, the value will be 140. For those aged 50 to 60 years, the value will be 150. For those older than 60 years, the value will be 160. And the random blood glucose, what happens before meals or after waking up? That is 80 to 120. Before bed, that is random blood glucose. Before bed, 100 to 140. This is the value. So what is the treatment? The treatment is by insulin pills, insulin injections, or by blood sugar monitoring. Thank you all for watching. Images used from the website for explanation purpose belongs to the respective owners. Thank you. Take care. Bye-bye.